12 major causes of high prolactin levels. High prolactin levels, also known as hyperprolactinemia. It's really impacting a lot of women's health, including men's health, and not just their health, their fertility overall. Because of high prolactin level, a lot of women have not been able to cuddle, carry their bundle of joy. So it's a cause for concern. With these 12 major causes, you are able to understand what is going on, really what is the cause behind high prolactin level if you're dealing with it. Because the issue is that a lot of women are like, what is causing this high prolactin level? And some women have taken a lot of medications and still the high prolactin level persists. I'm of the opinion that if you want to handle anything, hormonal issues, start from the root cause. With the root cause, you uproot it from there and not just treating or masking any symptom at all. Welcome to my YouTube channel. My name is Nkiru. I'm known as Health Therapy by Nk. Here I make videos on polycystic ovarian syndrome, infertility, hormones, androgen levels, insulin resistance, your general well-being as a man or as a woman. So go with me on this journey. First, we need to understand what prolactin is, how it's produced, the causes, and the factors that influence it. So prolactin, it's a hormone. And there's one mistake that we usually make. We think that once a hormone does a particular action, that is just it. Just like everybody knows, oh, prolactin is that hormone that helps with breast milk secretion. That is not all prolactin does. Prolactin helps in your general well-being as a woman, your overall mammary function, even in maintaining homeostasis. That particular mechanism that makes sure that your internal heat is okay, you are able to be kept alive. So when a hormone does a particular action, it's not just that. A lot is involved, just like progesterone too. It's not just about, oh, helping to take in your endometrial lining. It does a lot in keeping you active, in making sure you're not worn out, in keeping you happy, making sure you're not depressed. How exactly does prolactin levels, elevated prolactin levels, impact a woman's fertility? Before we do that, we need to establish the normal range. Prolactin level for women that are not pregnant, non-pregnant women, we're looking at values less than 25 nanogram per ml. Then for pregnant women, that is you're expectant, you will soon deliver, and you've done your hormonal profile estimation relative to prolactin level, you should be having a value between 80 to 400 nanogram per ml. And this actually depends on the stage of your pregnancy. Then for men, you should be having a value less than 20 nanogram per ml. How is prolactin affecting a woman's ability to get pregnant and carry the baby to full-term? Number one is by impacting, stopping successful release of an egg, which is ovulation. How does it do this? How is prolactin able to stop you from producing a matured egg, like crash that whole process? First, we need to understand that several hormones come to play a role when it comes to you getting your egg matured, dominant, released, and all of it. Okay. Number one is follicle stimulating hormone. Follicle stimulating hormone gets the follicle ready, like it gets it to, get bigger, get enlarged, very normal enlargement, so that yes, the luteinizing hormone can cause it to be out of the follicles. What prolactin does is that it shuts down this pathway. It decreases the production of follicle stimulating hormone and luteinizing hormone in turn. So when this process is shut down, it simply means that that woman is not able to produce a matured egg. And if you're not able to produce a matured egg, there is no way an ovulation will happen. There is no way a matured egg will be released. So by just this it looks simple, but it's really huge. It shuts down this mechanism, elevated prolactin level. And this is why some women that are nursing their babies don't get pregnant. This same exact mechanism is what they're using to do natural method of preventing pregnancy for women that are breastfeeding. A lot of women notice that during breastfeeding, they don't get pregnant, no matter the time of their intimacy and all of it. And this same mechanism is behind a woman dealing with high prolactin level and dealing with cyst period. Because if you don't ovulate, you're going to have cyst period in most cases. And sometimes you're seeing your period, but indeed, successful release of an egg did not happen. That means you're having an ovulatory cycle. You're seeing period, but there's no successful release of an egg. So how is prolactin produced? Prolactin is produced by specialized cells located in the pituitary gland. We have like a complex interplay that comes to play a role in prolactin release, its production too. So let's just look at the overview of it. Number one, hypothalamus plays a huge role in prolactin production and its release. Okay, by actually having this mechanism that gets dopamine on board. When dopamine levels are high, when dopamine levels are high, if I say this, you begin to understand, say, what will I do to actually increase my dopamine levels naturally? When dopamine levels are high, it helps to stabilize the prolactin release. It doesn't get overboard, it doesn't get too little. Because the essence of having hormonal imbalance, the hallmark of it is that you have too much of a particular hormone, or too little of a particular hormone, or too much of some hormones, or too little of some hormones. The emphasis, the key point, the hallmark, the goal point is for you to have a balanced. So with dopamine production from the hypothalamus, you're able to at least reduce prolactin level. You ask yourself, how do I increase my dopamine level? Dopamine is actually referred to as a feel-good hormone. Like it makes you happy, you feel pleasure, you feel relaxed, okay? We're not talking about you going to get dopamine in terms of taking hard drugs and all of it. No, we're talking about indulging in natural activities that you know that you feel satisfied. It makes you feel happy. It makes you feel pleasure in terms of you're happy, like in terms of maybe activities like dancing, activities like exercise, activities like gisting, healthy gist, okay, activities like outings and all of it, okay. It keeps your dopamine level high. That way, you're helping to regulate prolactin release in a healthy way, in a balanced way, all right. Remember that prolactin does not function alone. It's an interplay of other hormones and other factors that control it, all right? Then the pituitary gland, it plays a very, very important role in prolactin release too. Just like I said earlier, prolactin is produced and secreted by specialized cells in the pituitary gland. So you want to make sure that your pituitary gland is functioning optimum. Number three is when you're dealing with, three is stimulation by other hormones, especially estrogen. For example, in the physiological, that is the normal ways or normal mechanisms that prolactin levels get elevated, estrogen can come on board during pregnancy, and yes, it could help to stimulate production of prolactin levels at that time, but that is under normal circumstances. There is a twist of it for women that are dealing with high estrogen levels, estrogen dominance in pathological cases. That is the reverse is the case too. You tend to get a similar effect on your prolactin levels too. I want to make this point before we conclude that your prolactin level is high. At least do 3 or 2 tests to confirm that, because this leads me to my next point. 4, circadian reading. Our circadian reading can impact our prolactin levels. During sleep, like the prolactin level gets increased because at that time you're relaxed, it gets to increase. So before you conclude that your prolactin level is overboard, make sure you have considered your circadian reading. Very, very important. Then finally, there is the negative feedback mechanism. Prolactin itself has that capacity to exert a negative feedback mechanism on the hypothalamus. When it just says, oh, we're high, there's too much of prolactin circulating, it can just send a signal to the hypothalamus to stop or decrease the production of prolactin. Now, back to the main cause why I'm making this video. Causes of high prolactin levels, okay? We have the physiological causes and the pathological causes. When I'm talking about the physiological causes, I'm referring to normal causes that have no disease undertone behind it. When I talk about pathological causes, I'm talking about causes that have disease undertone behind it. So let's start with the physiological causes. Number one major reason why you could be dealing with high prolactin levels, hyperprolactinemia, is in cases of pregnancy and breastfeeding. Okay, there is nothing that stimulates prolactin level production like suckling or pregnancy hormones, like the body is getting ready to nurse a baby. So that is one physiological factor that impacts a woman's prolactin level. Sometimes the woman can be pregnant and they're not even aware. I encountered a woman that she was pregnant for 7 months and she didn't know. It's not a joke. She didn't know because she thought, oh, that she's not ovulating, she's not seeing her period. Her period stopped abruptly. Before, she didn't even know that she's already pregnant, okay? So until we insisted on her getting ultrasound done, when she did an ultrasound, the sonographer was like, oh, congratulations, your baby is doing okay. What exactly do you want us to find? Okay, she was shocked. So in such cases, because and she has been dealing with breast milk discharge, so she was like, maybe she's having hyperprolactin levels. So before you conclude that you're dealing with hyperprolactin levels, make sure you've been able to rule out pregnancy, that you're not pregnant at all, whether you are a married woman or not, okay? Make sure you have ruled out pregnancy. Number two is leading me to pathological conditions, disease cases that could happen and contribute to a woman having high prolactin level. Number one is when there is pituitary tumor. When the pituitary gland has tumor, this tumor, they can produce prolactin. That is prolactinoma now. It increases the level of prolactin. Most times when you get so high elevated levels of prolactin levels, as if you're pregnant or as if you're a nursing mother, check it. And you have signs that could lead you to think, oh, is there a tumor present? A tumor does not have to be large. It could be just a small size P tumor, okay? So when you get such, sometimes hyperprolactinemia with prolactinoma, that is pituitary tumor, it could come with headache, blurry vision, dizziness, you feel staggered and all of it. So check it. You need to go check it out. That is why it's important before you conclude anything. The third factor that could lead to elevated levels of prolactin level, it's polycystic ovarian syndrome or polycystic ovarian disease or polycystic ovaries. In polycystic ovarian syndrome, the women experience hormonal imbalance and it could impact the prolactin level. So sometimes you are dealing with polycystic ovarian syndrome with high prolactin levels. The emphasis is not for you to rush and start taking dustiness, carbamazole. The emphasis is for you to start working on balancing your hormones. Prolactin level will naturally come down with it because most times you overlook the polycystic ovarian syndrome and just focus on the prolactin. And as such, it might leave you not to get the right result relative to having successful ovulation. The fourth factor is renal insufficiency. When there is renal insufficiency, when I say renal insufficiency, I'm referring to a kidney that is not functioning optimal. It's going to impact the level of the prolactin clearance. Not just prolactin now, other hormones too. So when prolactin is not adequately cleared from the system, through the renal system, it's going to affect the levels. Liver dysfunction is another factor that could impact your prolactin clearance, metabolism from the system. The liver is playing a huge role in our hormone metabolism, and prolactin is not left out. So you are going to focus on actions that supports your liver option. Staying away from alcohol, staying away from processed food, overstressing yourself, smoking, tobacco, stay away from it. This way, you're optimizing your liver function. Your liver will not have any reason to be dealing with cirrhosis, hepatitis, or even cancer. It's going to be functioning optimal. All right. So the next one is autoimmune disease. Some women could experience autoimmune conditions. When we say autoimmune, it's referring to a situation whereby your own very self started attacking itself. Your body begins to see your cells as foreign bodies and begins to launch an attack on it. Okay, it could happen in elevated prolactin levels, such that the woman will begin to experience autoimmune conditions. It's not just about prolactin, we have several autoimmune conditions, but prolactin happens to be one of it. Another one is hypothyroidism. This is a situation whereby there is underactive functioning of the thyroid gland. That way, it's going to impact the way prolactin is produced. So anything to optimize your thyroid function, supporting it with seafood, iodine, make sure you're doing it. Even exercise, make sure you're doing it, all right? We have stress and exercise. The emphasis is on excessive stress and excessive exercise. But in this situation, is transient. It's just for that period of time, okay? Meaning that if you're able to lower your stress level, reduce your intense exercise, especially for women that are still in their childbearing age, you're able to lower your prolactin level. Constant exposure to stress, not just messes up your prolactin level, it impacts other hormones. So many women don't understand what we say. Take it easy on your stress level, especially if you have plans to still reprocreate, reproduce, get ovulation, have a healthy cycle. It's time for you to take it easy on your stress level. All right. Then we have certain medications. There are certain medications that if a woman is on, it's going to impact the prolactin level, like antipsychotic drugs, antidepressants, antihypertensive. Those drugs, they have the capacity to block the dopamine. Remember the first section we talked about dopamine helping to stabilize, modulate your prolactin release. Such drugs, they block that dopamine action and prolactin gets to just get secreted. If you're on those drugs, you notice that you're not really having that feel good feeling because the dopamine level is low. Next is idiopathic hyperprolactinemia. This is a situation whereby you don't know, the hospital don't know, the diagnosis don't know why you're dealing with high prolactin levels. They've done everything. You've done several blood tests, some machine, some, kind of examinations, all of it. Still, they could not lay their hands on why you're dealing with this high prolactin level. We refer to it as idiopathic hyperprolactin level. It's unknown etiology. It's not just about prolactin. There are several conditions that the condition, the reason, the root cause is not known why it's happening. All right. Then we have certain herbs, consumption of certain herbs and certain foods. It could lead to high prolactin levels in your system. So before you take any herbs, some of these foods that you consume, especially processed foods, make sure that yes, they don't have that capacity to trigger high prolactin levels in your system. Because the issue is that we're eating healthy, be on nutrition. Make sure that the nutrients you're getting is not going to give you a negative feedback mechanism in your hypothalamus, in your pituitary, that is going to still channel you into the focus that you want to eat. The truth is that yes, eating healthy doesn't mean that all the foods that are out there, even though they're natural, and that is what is supporting your hormonal function. No, so you need to do what? Check it before you consume it. All right. Then finally is chest wall irritation or just chest wall injury. We're talking about the breast is located on the chest proper. Okay. So sometimes you have injuries. It could be maybe a surgical scar or irritations like herpes zoster can cause irritations. It comes with shingles. So many women that are experiencing shingles, they notice that their breast is discharging fluid, and when they go for tests, it usually comes out as high prolactin levels. Okay, so you want to make sure you're not exposed to herpes zosters. Usually it's referred to as chicken pox. It could cause an irritation that could trigger prolactin production. On a final note, assuming you're dealing with high prolactin levels and really you want to heal from high prolactin levels, stabilize your prolactin, cause the ovulation to happen, cause the eggs to mature and be dominant enough to be released from the ovary, I have just one advice. The advice is, if you could recall from the beginning of the video, I said that the most trigger of prolactin production is suckling. Whether it's a baby that is suckling it, whether it's a full-grown human being that is suckling it, you need to pay attention because that sensation stimulates prolactin production. So if you're somebody that you want to really lower your prolactin level, it doesn't make sense that you're taking all of those treatments or even the targeted lifestyle modifications and you're still exposing your breast to stimulations, to external stimulants. It's still going to impact the level of that prolactin. So that is the reason why you keep treating and it keeps happening. Don't tell me, oh, he does not understand. Explain to him because really you're the one facing this. Really you're the one going through that trauma. Really you're the one, your body is getting so messed up like that in terms of that hormonal imbalance, okay? And you don't like it. I don't think that giving yourself a break from suckling for 3 months so that your hormones can stabilize is such a huge sacrifice. It's not such a huge sacrifice. Assuming you're serious on balancing your hormones and really having a successful ovulation, get pregnant and carry your baby to full term. All right. Thank you for watching this video.